Hi. Understanding the physiology of our bodies is so important. Chronic neck pain, back pain, pains radiating into the arms and hands, weakness, pains into the legs, just excruciating pain day after day. You've taken all kinds of drugs and medications, potentially might have even done injections or epidurals, but the pain is still there. Well, we have to be strong. From my own experience, I can tell you that I've experienced conditions of pain that lasted for quite some time, but we have to understand that when there are conditions in our body, many of these symptoms that arise out of the blue, understand what's been going on underneath, like below that tip of the iceberg. That's been accumulating over time, potentially from your work, the stresses that you do day after day, types of incorrect lifting or sleeping or just bad posture. The tip of the iceberg finally makes its way through and we start experiencing these horrible, horrific symptoms of pain or radiation or tingling or numbness or wherever it may be in your body. Understand that when nerves are trying to heal, they take a long time. In other words, that symptoms are usually the first thing to arise and the last thing to go away. So we have to be patient. The majority of people who get surgeries cannot withstand their pain, although the majority of surgeries are not successful. Also, using moist heat, ice, and other alternatives like natural anti-inflammatories. There are many herbs like turmeric and bromelain, just to name a few, that can help reduce the inflammation of our bodies. You must be patient. Even though these symptoms are arising, there is a causation, and the causation does take time to repair, that the body has to go through its normal physiological time in order to repair. But the body has a way of making compensatory changes. It has a way of masking pain over time. It has a way of dealing with those pain signals that are going to the brain. You have to be strong. You have to sit this pain out, because the majority of these symptoms will subside within time. The most important thing is loss of reflexes, wasting away of muscles, loss of the ability to use the upper or lower extremities, or potentially problems with the bowels and the lower back or intestines, or even the urinary tract system. But if you're not having the loss of muscle, you have normal reflexes, you're not having wasting away of the muscles and other significant positive findings that we would normally find in a medical office, there's no danger, there's no harm. I would always tell you to follow up with your medical physician to be certain that everything is okay. But as long as there's no danger involved, you need to be strong. You need to sit out these symptoms. And I tell you from experience that in the majority of cases, the body has ways of masking that pain. It has ways of balancing out, equalizing the normal integrity of what the body used to feel and how it can feel. Remember this: the majority of people who have pain, they rush to the doctor. The majority of those conditions will require, by the physician, something invasive: epidurals, steroid injections, or even surgery. I will tell you this from experience, not only myself, but clinical experience, almost 30 years of practice. You need to give the body a chance to repair and heal. You may not ever repair 100%, but if the pain can subside to a certain level where it's tolerable, you're going to be a lot more better off with normal physiological function than have a permanent impairment as a result of other complications. If you have any questions, you can shoot me an email. I'll be more than happy to answer them for you. But remember the intelligence of the body, what it can do on its own, as long as you give it time. Make it a great day. I'm Dr. Alan Mandell.